I'm Kelsey. I'm going to be your student nurse today. We're going to do a full head-to-toe assessment. But before I do that, I'm going to go ahead and wash my hands and provide some privacy as I collect my supplies as well.
Okay.
Privacy provided. Okay. Angel, we're going to start out with a few questions. If you could provide your first and last name for me. Okay. May I see your wrist? Thank you. Is that the correct spelling of your name?
Yes.
And what's your date of birth?
May 4th, 1972.
Great. Thank you. Do you know where you're at?
I'm at Rasmussen.
Okay. And do you know what today is?
Wednesday.
Great. Thank you. Patient's cognitive ability is alert times 3. Now I'm going to check your hygiene and your posture. Patient's hygiene is good. Posture is good. And spine is aligned. Okay. Now I'm going to do a few sensation tests on your face. If you feel uncomfortable at any time during the test, just feel free to let me know. I'm going to start out by having you close your eyes for me, and I'm going to touch an area on your face, and I want you to tell me where I touch.
Forehead. Right, left cheek.
Okay, you can open your eyes. Can you raise your eyebrows for me? No redness or discharge around the patient's eyes. No discharge around the nose. If you could, go ahead and walk off one side of your nose and breathe in and do the repeat for the opposite side. Good. Okay, can you go ahead and puff up your cheeks? Good. Give me a big smile. Awesome. Now I want you to go ahead and open your mouth. Stick out your tongue. Great. Lift your tongue for me. Good. Patient's mouth is pink and wet. No sores or lesions are visible inside. Now I'm going to inspect your ears, and I'm going to do a whisper test as well. No lesions or cerumen or discharge in the patient's ears.
Okay.
And now I'm going to test the dilation of your eyes. So if you will, look straight forward at that wall for me, and I'm going to shine a little bit of light in your eyes. Okay. Keep looking at the wall. Now look at my finger. Patient's pupils are equally round and reactive to light and accommodation. Your lung assessment. I'm going to listen to a few spots on your front, your back, and your sides. So if you will, as I touch the stethoscope to you, I want you to go ahead and breathe in through your mouth. Okay? Okay. Can you lift your right arm for me? Okay, you can put that one down and lift your left arm. Great, now let's go to your back. patient's lungs are clear, depth, rate, and rhythm are adequate. The patient is not barrel chested. The anterior posterior to transverse ratio is a 2:1. Now I'm going to go ahead and I'm going to listen to sounds. Okay? So just breathe normal. We're going to listen to the second intercostal space, which is right of the sternum. Second intercostal space, left of the sternum, pulmonary space. Third intercostal space, Erb's point, left of the sternum. Fourth intercostal space, left of the sternum. Tricuspid. Fifth intercostal space, mid-clavicular line, mitral valve. There were no abnormal sounds. That was great. Thank you. All right, Angel. Now we're going to go ahead and we're going to have you lie down. We're going to do an assessment of your abdomen, okay? All right. First, I'm going to listen, and then I'm going to palpate. I'm going to listen starting with the right lower quadrant. Okay. Right upper quadrant. Left upper quadrant. And left lower quadrant. Okay. No abnormal bowel sounds were heard. Now I'm going to palpate your abdomen. If you have any pain or discomfort, just feel free to let me know. Okay? Upon assessment of palpating the abdomen, no discomfort was communicated or observed. When was your last bowel movement? And urination, have you had any problems or discomfort with that?
No.
Okay, thank you. Okay, now I'm going to go ahead and I'm going to get the pulses on throughout your body. The first one is your dorsalis pedis. And the pulses are strong and symmetrical. The next one is the posterior tibial. Pulses are strong and symmetrical. Now I'm going to go ahead and get your radial pulses. Pulses are strong and symmetrical. Next is the brachial. Pulses are strong and symmetrical. And now I'm going to get the carotid one at a time. Pulses are strong and symmetrical. Now I'm going to check your capillary refill. Capillary refill is good, and I will be checking for edema, redness, and your temperature as well. Okay. No edema, redness, or tenderness was observed. Okay, Cameron, now we're going, Angel, now we're going to do some strength exercises. So I want you to go ahead and push on my hands. Okay, go ahead and pull. Great. All right, if you could swing your feet around for me, sit up. Thank you. Okay, now I want you to go ahead and push on my hands. Pull on my hands. Good. I'm going to put my hands here. I want you to push my hands in. Okay, pull my hands out. Great. Do the same with your arms like this. Don't let me pull, and don't let me push. Great. Go ahead and stretch your arms out for me. Same thing. Don't let me push, and don't let me pull. Great. Okay, now we're going to do, you can put your arms down, I'm sorry. Now you can do range of motion. I'm gonna go ahead and have you rotate your ankles. Good. Rotate your wrists for me. Okay, stretch your arms out. Rotate your arms. Okay, touch one shoulder. Bring your arm down. Same with this side. Great. Okay, and if you will, turn your head. Turn your head the opposite way. Look up and look down. Did you feel any pain or discomfort while doing those exercises? Great. Patience, range of motion, and strength upon assessment was adequate and good. Okay, so if you will, go ahead and stand up for me. Okay, just going to do some simple balance exercises. So if you will, go ahead and close your eyes for me. Okay, open your eyes. If you will, take 3 steps that way. And 3 steps back. Great. Okay, you can have a seat. Upon assessment, patient's balance and gait is stable and good. Great. That concludes our head-to-toe assessment. So if you have any problems, questions, or concerns, feel free to let me know. Are you comfortable right now?
I'll be able to play demo.
Okay, feel free. All right. If you have any more concerns, here's your call light. And yeah, that concludes our assessment. So I'm going to go document my findings and wash my hands. Provide patient privacy. Hi, my name is Kelsey Robinson, and I will be demonstrating how to properly wash your hands. First, I'm going to start out and get some paper towels for after I'm done washing. Next, you want to turn on the water and apply antibacterial soap. You wash your hands for approximately 20 seconds, and while washing your hands, you wash in between the fingers, under the nails, and around the cuticles. And if you have calluses, be sure to wash those areas extra as well, as germs like to live in the cracks. Then you rinse your hands. After your hands are thoroughly rinsed, you take the top clean paper towel and you dry from the fingertips with pat dry all the way up to the wrist. And this is to prevent pulling germs from the dirty part of your arm to the clean part of your hands. Once you're done patting the hands dry, you take a clean paper towel and shut the water off. And that's how you wash your hands.